Do you ever catch those health commercials on TV that say something like, talk to your doctor before starting an aspirin regimen? Ever wonder what that's all about? Well, we're exploring that today as we continue our Heart Health at 4 series during American Heart Month. So joining us now to talk about this is Dr. Sandeep Das. He is a cardiologist and director of acute coronary care at Parkland Health. Doctor, thank you so much for joining us this afternoon.
Thanks for having me.
So apparently millions of Americans are taking aspirin every day for their heart, not because they're having pain, but they're trying to help their heart health. So let's explore that. What's going on there?
Absolutely. So, I think the medical community bears a decent share of the blame for this. For many years, we kind of beat it into people's heads. So you take an aspirin today, take an aspirin a day. It keeps the doctor away. More and more research is coming out that the benefit of aspirin in low-risk populations is actually quite low.
Okay.
The harm is also low, but that the trade-off is not as obvious as it was. In high-risk populations, people have had a heart attack, had a stroke, had heart procedures, stents, things like that. Absolutely. Almost all those patients will be on an aspirin.
So what is it about the aspirin that helps to avoid these types of scenarios?
Great question. So your blood has little things called platelets, little tiny, kind of think of them as floating Band-Aids that float around in your blood. If you have a cut, they sort of all glom onto it, which is great if you cut your skin. But if you have an irregularity in one of your coronary arteries, the arteries that feed blood to your heart, if you have an abnormality in there, or an irregularity in there, and the platelets think that that's foreign and think that that's something they should clot, they'll all start sticking together.
And clots are not good
clot
for the heart,
artery,
obviously. And
then you can't get blood past that clot, which again, great if it's in your hand, but terrible if it's trying to feed blood to your heart. So what asprin and drugs like it do is it makes the platelets a little less sticky, so they don't quite stick together as well.
Basically a blood thinner.
Yeah, I want to cringe a little, so I'll explain it. So there's a class of medicines that are full-on anticoagulants, things like warfarin, that can fully thin your blood and make it very hard for you to clot. Aspirin is sort of a very mild blood thinner.
Okay.
But absolutely, so it increases your risk of bleeding a little bit, but it decreases your risk of forming clots and decreases your risk of heart attack.
So how often and how much aspirin would somebody who's trying to avoid the scenario be taking?
Absolutely. So in someone, the actual dose is a little bit unclear, believe it or not. After all these decades of aspirin, the two doses to consider would be 81 milligrams or 325, so a baby aspirin or an adult aspirin.
Okay.
In Europe, they use a lot of 75 to 100. We don't really have those doses available here. There's not really a reason to choose one or the other. I generally favor 81. There's actually a big study going on right now called Adaptable that's looking at that specific question, randomizing patients to 81 versus 325 and trying to see some outcomes. So, several years down the road from now, we should be able to have some information on what the right dose is. But right now, I think 81 is as good as 325.
Interesting. And just a few last 4 seconds we have here. Heart attack, taking aspirin during, how does that actually help?
So it's the exact same thing. So a heart attack is a clot, and taking aspirin makes that platelets less sticky. So it prevents the clot from forming as easily, and it can help prevent progression of that clot.
Okay, so if someone were want to take aspirin, of course they'd have to have a conversation with their doctor to figure out what dosage would work for them and that sort of thing before hopping on it.
Absolutely, but if you're having crushing chest pain, chew an aspirin.
And go call a doctor, get medical help. All right,
Absolutely.
Dr. Das, thank you so much for joining us this afternoon. Really appreciate it. When we come